By the end of 2019, we were shocked by a news that was spreading around the world. A novel coronavirus has been found in Hubei, China, and had spread in many countries worldwide. The novel coronavirus has been confirmed to have reached Malaysia in January 2020. The latest update from 29 June 2020 from World Health Organization (WHO) Coronavirus Disease Dashboard stated that there have been more than 10 million confirmed cases of COVID-19, including more than 400,000 deaths reported to WHO. How the virus spread, why we need to normalize the usage of face masks and hand sanitizer. This is because the virus can spread through small droplets when a person with COVID-19 symptoms cough or exhale. This is proof that we have to wear face masks to protect ourselves from people when they cough or sneeze around us. Another person can catch the virus by touching any objects from the surfaces. Besides, the COVID-19 virus can last on surfaces, especially metal and plastic, up to 3 days. So this is proof that when we touch something, we can also get infected by the virus. That is why we have to keep our hands clean before and after we touch something by using hand sanitizer. New norma have been practiced in Malaysia to keep people aware about this virus. The Director General of Health Malaysia, Dr. Nur Hisham, saved Malaysia with these words: "Stay safe and stay at home." To encourage people by stay wherever they are, so the COVID-19 chain can be break down. I'm Noradibah Elkha binti Ramli, a reporter from TV Citra.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Hazrati binti Razali. Here I am today as a doctor from Immunology Department, ready to discuss further about COVID-19 issue, especially about the high-risk groups and how long does coronavirus last in body. Ladies and gentlemen, do you know that COVID-19 virus can infect people of all ages? But then 3 groups of people are at high risk of getting COVID-19 disease. These high-risk groups include people over 60 years old, people who have serious medical conditions like diabetes, cancer, or conditions that affect their immune system, and also infants. If you are at high risk, please take an action to reduce your risk of getting sick and take everyday precautions. For instance, wash your hands often with soap and water for at least 20 seconds. Avoid contact with people who are sick. Clean and disinfect surfaces in your home. If you have started feeling sick and have symptoms like fever, cough, or shortness of breath, immediately call doctor or 911. It is important for people at high-risk groups to protect themselves from getting COVID-19 disease. This leads me to the next point about how long does coronavirus last inside the body. The coronavirus is spread through respiratory droplets and do not tend to remain airborne, but they can travel about 6 feet through the air. So, if a person is close to an infected person, moving through a crowded area or touching surface or object, there is possibility of exposure to COVID-19. However, the Center for Disease Control and Prevention (CDC) states that symptoms typically appear 2 to 14 days after exposure. Majority of people develop symptoms within 14 days of getting the virus, or it can take longer than that. If you have not developed symptoms at that point, you are likely in the clear. How long the symptoms last depends on the severity of the case, and the patient with coronavirus will make a full recovery within 2 until 4 weeks. In conclusion, people need to stay healthy and please follow the advice on how to protect yourself from coronavirus, and also take some precautions to help prevent the spread of the coronavirus. During this pandemic of COVID-19, we are all encouraged to stay at home and see doctor if you have symptoms of coronavirus. Next, I will pass to Noranah Afidah to give her thoughts on this COVID-19 issue.
Assalamualaikum Doctor, I am Noranah Afidah Garahana. I am the third presenter. Today, I would like to take this opportunity to explain about vaccine as a patient perspective. As we know, there are no antivirals or vaccine to treat or prevent COVID-19 until now. However, many of the symptoms can be treated and therefore treatment based on the patient's clinical condition, such as fever, cough, and shortness of breath. There are at least 44 potential coronavirus vaccines in development. Several antivirals, including those against flu and HIV, are being tested to see if they could be used against the new coronavirus. The use of three of medicine such as chloroquine, hydroxychloroquine, and the lopinavir or ritonavir combination has been seen to affect the treatment of COVID-19 patients since it was detected in this country. Health Director General Datuk Dr. Nur Hisham Abdullah said on press conference, chloroquine and hydroxychloroquine, previously used for the treatment of malaria patients, were given to COVID-19 patients because they are anti-inflammatory.
Sejak gelombang pertama lagi kita telah menggunakan obat chloroquine yang digunakan untuk penyakit malaria, dan obat tersebut dapat digunakan untuk penyakit COVID-19 kerana dia ada anti-inflammatory, iaitu anti radang. Jadi kalau kita lihat penyakit COVID ini menyebabkan saluran pernafasan bawahan terlibat. Bila saluran pernafasan, jadi virus melekat di saluran pernafasan bawah akan menyebabkan inflamasi dan juga replikasi virus tersebut. Dan ini menyebabkan radang di saluran pernafasan bawahan dan menyebabkan pernafasan itu terlibat. Dan banyak lagi radang di kawasan tersebut, dan ubat ini membantu untuk mengurangkan inflamasi di saluran pernafasan bawahan.
Let's move on to the next point is about the fake COVID-19. As we have seen on social media, too many fake information or the false is being spread all over the world, such as the fake about ordering or buying products shipped from overseas will not make a person sick. As you all know, before the packaging shipped from overseas to our country, they will go through the process of disinfection first. Next is about drinking alcohol does not protect you against COVID-19, but it can be dangerous to our health. The last is exposing yourself to the sun or to the temperature higher than 25 Celsius degrees does not prevent the coronavirus disease. Last but not least, we are not just fighting the pandemic but an infodemic as well. Now, I will pass the next point to my colleague Rima to explain the myth about COVID-19. Thank you.
Assalamualaikum, my name is Rima binti Abdurahman. I'm the last presenter of my group. So today I would like to take this chance to talk about the myths of COVID-19 from citizens' perspective. As a citizen, I have to aware about this issue, about this pandemic spreading worldwide. So, from my own observation, there is 5 myths that I will explain more about it. First of all, antibiotic can prevent and treat it, which is exactly myth, because antibiotic works only against bacteria, not viruses. COVID-19 is caused by a virus, and therefore antibiotic should not be used for prevention or treatment. However, if you are hospitalized for COVID-19, you may receive antibiotic because bacteria co-infection is possible. Second, hand dryer are effective in killing the COVID-19 virus, which is exactly not true, because to protect yourself, you must frequently clean your hand with alcohol-based hand rub or wash them with soap and water. Next, the idea of the cold weather, hot bath and garlic will help to treat the virus. Well, there is no reason to believe that this method will help to prevent the coronavirus. The normal human's body temperature remains around 36.5 to 37 Celsius regardless of the temperature, the weather, or bath or shower that we take. And what about garlic? Well, garlic is a healthy food that may have antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from this virus. Moreover, spraying and introducing bleach or another disinfectant into your body will protect you against this COVID-19. Well, that's not true because you should not under any circumstances spray or introduce bleach or any other disinfectant into your body. Remember to keep bleach and any other disinfectant out of reach of children. Lastly, being able to hold your breath for 10 seconds or more without coughing or feeling discomfort, meaning you are free from COVID-19. Which is not true because the most common symptoms of COVID-19 are dry cough, tiredness, and fever. Some people may develop more severe form of the disease, such as pneumonia. The best way to confirm if you have this virus producing COVID-19 is with a laboratory test. You cannot confirm it with this breathing exercise, which can even be dangerous. In a nutshell, as for conclusion, we should protect ourselves from COVID-19, which is by staying at home, practice social distancing, take care of our health, and keep a good hygiene. Last but not least, thanks to the frontliner for the good services and the good heart for help to fight this pandemic COVID-19. Hashtag we care each other, hashtag stay at home. Thank you very much.